All right. Good morning, everyone. Welcome to the February Brooklyn DD Council meeting. Appreciate everyone being here and hopefully being safe and warm, even though we have Ellie in her igloo. Appreciate you hooking up the Wi-Fi in that. Um, we do have our regular updates, assuming whoever makes it on can give them. We have a presentation by the Steps to CUNY program, and I did see Jordan was on with us, so that's great. Um, I was away last week, so I apologize. I know there's a lot of emails where people sent me to share out. So what I will do after this meeting, or maybe after snow blowing and shoveling, so later or tomorrow, instead of sending 100 emails, I'll put them into like the newsletter formats that I sometimes do, so you guys can get all the stuff that was sent while I was away last week, and that way people won't be overwhelmed. Big announcement in terms of the council is, as you guys have seen reminders last week on our website, the 5 borough legislative town hall is coming up on Friday, March 6th, 10 a.m. You do have to register. You will not be able to get in. You will not get a Zoom link if you do not register. So please go to our website. It's the first thing pinned to the top. It's also pinned on our Facebook page. We're changing up the format this year slightly. All 5 boroughs are still working together, but we're doing panels instead of just each borough taking a topic. There's going to be similar topics and panels discussing those topics. The panels will be made up of parents, advocates, elected officials, and professionals in the field. But that is Friday, March 6th via Zoom, and you do have to register. At some point when someone else is presenting, I'll make sure to put the link in the chat for the flyer. Any other news from the council? Rochelle, what am I missing? I know there's something.
No, I think you hit it.
Yeah, really, that's it. That's the focus for right now. Getting a successful legislative town hall. All right. So I did see that Nina joined us. Nina, appreciate you being here.
Good morning,
So
everyone.
if you're ready, I can pass it to you for the OPW update.
Okay, thank you. Good morning, everyone, and thank you for being here on such an epic day, right? With so much snow outside. I know how important it is for families and for everyone to hear from OPWDD and to have some updates. Today, I'm going to start with a fiscal year 2027 executive budget and what it means for OPWDD services and for our agencies, for providers, and for families. So I'm going to start with the overall fiscal picture. New York State enters fiscal year 2027 in a stable financial position, and the state maintains approximately $14.6 billion in principal reserves, which are set aside to protect essential services in case of economic downturns. The general fund for fiscal year 2027 is balanced. That stability is important because it reduces the likelihood of sudden or unexpected cuts to our critical programs and services. As you know, Medicaid is the backbone of OPWDD services, and for fiscal year 2027, Medicaid spending is projected to a total of $38.2 billion, which represents an 11% increase over the prior year. Medicaid funds our residential services, day programs, self-direction, clinical supports, and many other services that we rely on and our families rely on. The increase reflects higher service utilization, minimum wage increases, reimbursement adjustments to the agencies, and continued needs of aging and high support populations. From a service perspective, this means that state is recognizing ongoing demand and cost pressures within the system. However, Medicaid is also where we see the greatest exposure to federal policy changes. Federal funds account for roughly 1/3 of state budget, and the majority of those federal funds are tied to Medicaid. There is ongoing federal discussion about potential Medicaid reforms, of course, sharing changes. And at this time, there is no announced reduction to OPWDD for eligibility or course services. But we are closely monitoring federal actions because any changes at that level could affect funding streams in the future. So, but I want to be clear that there are no announced cuts for the fiscal year 2027 executive budget for OPWDD. Services continue and eligibility standards remain unchanged. Residential day and other self-direction supports remain funded. The budget also includes a 1.7% targeted inflationary increase for certain eligible programs. While it doesn't seem like a lot, but this type of increase supports human service providers and helps address workforce stability. We all know that staffing remains one of the biggest challenges across our system, and any investment that supports provider sustainability contributes to continuity of services. In addition, the state continues capital investments in health and mental hygiene systems. While many of those investments are more directly related to mental health and hospital transformation, they indirectly support individuals with continuing needs and strengthen hospital to community transitions. So for OPWDD, our focus remains on maintaining residential stability, monitoring UCBS waiver utilization, supporting provider compliance and fiscal sustainability, continuing development and housing initiatives, and ensuring smooth transitions from institutional hospital settings into community placements. We also continue to track housing development, subsidies, sustainability, and capacity expansion carefully. While the executive budget summary does not identify a new OPWDD specific housing capital line, we have a broader statewide housing investments to create opportunities for collaboration and long-term community integration. And this is annually OPWDD announces ISH applications for the providers who would like to become housing for the providers who would like to deliver housing subsidy program. The state strong reserve position provides a cushion against economic downturns that does not eliminate the risk, but it does provide protection against sudden fiscal shocks. Additionally, New York State historically prioritizes Medicaid and safety net programs when navigating fiscal adjustments. For OPWDD, our commitment is transparency, and if there are any policy changes or some adjustments or service impacts, we will inform providers and other stakeholders promptly. And I'm going to close with a budget update that 2027 budget reflects fiscal stability, continued Medicaid growth, provider support, and ongoing system investment. There are no announced reductions to OPWDD services. Federal risks exist, but they are being actively monitored at the state level. The next, I'm going to switch to some updates that are taking place, initiatives at OPWDD. I mentioned in previous months that we are working on system improvements, and one key initiative is underway is the capacity management application. We had phase one, which was implemented last year, and the goal is simple, to ensure that the referral packets for certified residential placements reflect current needs and will help us to improve screening efficiently across the system. Commissioners Task Force on Aging is actively developing recommendations on focused on aging with dignity in community settings. The task force is addressing 4 core areas that are non-residential supports, caregivers and circles of support, health and wellness, and accessible housing. The workforce will continue to work throughout 2026. In addition, home enabling supports, a new service under the waiver, is expected to be launched in March. We will have more training for the care managers with this new service coming online. And none of this work will happen without the strong workforce. The CUNY DSP micro-credential initiative now has over 1,600 participants statewide. Our partnership with NADSP continues to extend credentialing opportunities. The modern work recruitment campaign that I was talking about for 2 years in a row has that campaign actually generated significant engagement and helped connect applicants with providers across the state. Employment first remains a priority for OPWDD. It's also governor's initiative. OPWDD is finalizing an implementation plan at the end of February, and then we continue to work with stakeholders to improve access to competitive and integrated employment. And also, I think mentioned previously that OPWDD, we have released self-direction and care coordination evaluation reports. Both reports include recommendations on improving the system, improving the accessibility to the program, and ensuring sustainability for the future. We recognize that continuous improvement is essential, and the input from the families and stakeholders remain critical to the work that we do here at OPWDD. So as we move into 2026, our focus remains steady on strengthening the access, stabilizing workforce, improving transparency, advancing equity, and supporting independence and employment for the individuals in our system. So I guess this is all for me for today. So I'll take any questions you may have.
Thank you so much, Nina. Does anyone have any questions for Nina? I don't see any in the chat. I don't see any hands.
Mm-hmm.
All right, you got an easy day, Nina.
Oh, thank you. One thing I want to quickly mention, I forgot, we are actively working on the revision of the housing subsidy ADM. The public comments are gonna hopefully will be released in March. Also, we have a work group that is working on edits to the self-direction ADM. So it's also, we're expecting to hear some official updates in April. And we have announced a week ago, we also announced an initiative for residential providers throughout the state who are interested to participate in community transition incentive. That's where OPWDD is offering additional funding for the agencies to transition age-out students and individuals who are in the hospitals into existing vacancies. So that is something that we are currently focusing on, and hopefully we will have the successful update result of it. Okay, that's it.
Thank you so much. No questions? Okay, thank you, Nina. Next up is Kate with the update from IAC.
Hi, everyone. I am just putting into the chat some documents that I'm going to refer to today. The IAC report for February is, as Brian mentioned, as we get ready for the town hall, and as we've just come back from IAC's lobby days up in Albany, just wanted to review our priorities for the field for the state budget. So as Nina pardon me, I'm getting so many emails from so many people who are stuck somewhere and not able to fly back, as I'm sure you all are all too. Nina just went over the state budget, and so I'm going to also, if you want to open up some of those documents, I'm going to start with the final NIDA New York State budget asks. And pardon me, I'm going to share my screen. Bear with me also. IAC is in the midst of a migration of our server and all of our internal tech architecture. We are soon to move to new offices across the street, hopefully within the month. So hope that lots of you will be able to come join us at our new offices, which we will let you know whenever we're fully up and running. But also, I'll make an announcement about the upcoming IAC Aging Conference, which certainly everyone is invited to. It is next week. I'm so sorry. I'm trying to find, I've got them into the chat, but can't quite get them open. So just to recap, and do I have sharing abilities? Yes.
Yeah, I made you a co-host, so you should be good.
Thank you. And if I'm not able to see the screen, please interrupt me at any point if you have any questions about any of the items. I can do my best to answer. A lot of them I'll certainly be able to answer, but if there's something that I cannot, then Brian or someone here, and also I can certainly connect you to one of our policy experts. So here, can I make this a bit larger for folks? Is that better? Okay. We have talked through a lot of these items. You will see the one pager. What I'm really going to focus on is in the governor's budget, she recommended a targeted inflationary increase for OPWDD of 1%. We need state legislators to prioritize in their one house budgets, and that's the ask. If you're talking to legislators, you want them to talk to their committee chairs, talk to the chair of the health committee, and to prioritize an additional 1.7% for the targeted inflationary increase for OPWDD. So moving from increasing the governor's request for 1%, an additional 1.7 to 2.7%. I'm sorry, she put in 1.7. We need the additional 1% to make it 2.7%. We also need for the legislature to include care coordination organizations in this increase. They have not been included in the past. I think we all know the value and the importance of care coordination organizations. So we really need legislatures to understand that this is a system, and we need all of our parts taken care of and included in this targeted inflationary increase. So an additional 1% to bring the TII to 2.7%. That's the ask, rather than getting into any of the additional details, which are all spelled out in this one pager, but also in the budget paper that I will also, bring everyone's attention to momentarily. All the details are in there. We just need you to get the message across that we have to have 2.7% for the stability of the system, for the dignity of our DSPs. Non-negotiable, must be included in the one house budgets. There are also a number of CareForce initiatives at the town hall next Friday. You will hear about all of these in detail. These are a package of initiatives that make living in New York more affordable, more possible for our CareForce, which is the term that we're now using to describe, again, our DSPs and all of the employees and staff who make the work that we do possible. So it includes things like an affordable housing lottery preference, um, an employer-assisted housing matching grant program, the Sony May CareForce homeownership incentive, the New York State Child Independent Care Credit, and restoring the health enhancement program. This is particularly in light of cuts to ACA and coming cuts we expect to the New York State Essential Plan and rising costs both for employers and for employees with regard to healthcare. Are there any questions about those asks? Okay. Moving on to early intervention and the state education department. For early intervention, for a long time, we've been saying that New York State is in crisis. We're well beyond that point now. It is a system that even, a week ago, 2 weeks ago, another long-term provider who has been in the business of early intervention has, made it their mission, will be closing in the coming months. And there has not been an announcement yet, but it is devastating to our field and certainly for the availability of these crucial, critical services for infants and toddlers and their families. We are beyond the breaking point. There are counties in New York that do not have even one in-person provider. We cannot compete for service coordinators who are the backbone of that program to the related service providers, ABA providers, speech OTPT. This is a vital service. It has been shown, there's a lot of research, longitudinal research to show the impact of early intervention, the transformational difference that it can make in the life of an infant and toddler. It is really hard to understand why we are struggling as much as we are and have been to get the increases that early intervention and the system absolutely it must have. What we're asking for, especially in light of the landmark investments in universal childcare, which we absolutely are, thrilled to see. But if we do not prioritize and equally invest in children and infants and toddlers with disabilities, we're really sending a message about how we value people with disabilities. So at any rate, here's the one pager for early intervention. The priority is, and let me know, I'm going to try to make it a little larger. The priority is to implement the state share of the 5% increase. If you just said implement the 5% increase that was passed in the 2025 budget, it was already passed. It was already prioritized. They've just never implemented it. Parts of that, for those who are interested, is because CMS, it has been with the Federal Office of Medicaid, the Centers for Medicaid Services, since December 2024. They have been sitting on it. You are more than welcome also to reach out to your state representatives, your federal representatives, and let them know that they need to put pressure on CMS, the folks at CMS, to get this passed. We need the state to, at the very minimum, implement the state share of that 5%. We're also asking for an 8% stabilization investment. There is a rate reform bill that has been out for a few years. It's been reintroduced. We're asking for that to be in the budget, for funding for that to be in the budget so that we can determine finally what appropriate reimbursement rates for early intervention would be. And just to let folks know that when we met with the Bureau of Early Intervention and other committee chairs, legislative directors, and chiefs of staff up in Albany, there is understanding that the reimbursement rates for early intervention are and have been absolutely inadequate. So we just need, members of our community to let their legislators know that this is unacceptable. New York State is, 48th in some things, 49th, 50th in others. It's um, it's a disgrace. We can do better. The amount of dollars that we're talking about when it comes to early intervention are so small compared to all other services, and the amount of impact is so huge. It is really unthinkable that we're not investing as much as the system needs. Okay, moving on to SED. And I want everyone to feel energized, that not just upset, but if anger helps, get angry. As long as you don't get angry directly at the legislator, but let them know how much it matters to you. If the other thing is letting their staff know, the more that we call and say, I want to talk to you about early intervention, one of those staffers at some point, we've talked to staffers and they say that, fly in that mosquito, that buzzing, that whenever folks are constantly letting us know this is an issue, this is a priority, what are you doing about early intervention? Eventually, they have to make their legislator pay attention, and their legislator will go to their, the committee chair or the director of their legislative group and talk to them about, prioritizing these issues. So it really does make a difference the more that we reach out and talk about the issues that are important to us. Okay. SED, just to make this quite short, the the budget for 4410 special education preschools and 853 school age special education programs is not handled at this time. It is done later in the spring through what's called a tuition methodology letter. So at this point, there are asks. I encourage you please to review them. The number one ask right now is this issue of FAPE 22, which I'm sure you've heard us talk about in the past. There have been a number of court rulings, including a Supreme Court ruling, that determined that New York State must allow students with disabilities who have not earned a high school diploma or met their IEP transition goals to remain in school through their 22nd birthday. It's actually not through June 30th. So what we're asking is for budget language and funding to ensure that students with disabilities can remain in school through their 22nd birthday and through June 30th of that year, so that they're graduating with their classmates at a normal time that gives schools the ability to budget for staff, for teachers, for support staff, and also allows for the appropriate planning to happen. Right now, school districts are not being compensated. They're not receiving the school aid that they would be entitled to for those students. And this really places a terrible burden on localities, on school staff, on educational directors who cannot plan for this process. It's terrible for families. We had students last year who were unceremoniously and through no fault of any of our schools, I want to say. It's just a tremendous pressure when their district is not having conversations or not permitting them to keep a student, right? And that there was lack of communication from DOE folks. It was really terrible. So we need to fund FAPE 22, to amend the state education law to codify that and fully fund services. That's the ask. Fund FAPE 22. It can be quite simple and straightforward. We're also asking for an investment in ETTPP, which is the Excessive Teacher Turnover Prevention Program. It is currently funded at $8 million. We want to expand that. It hasn't been increased since 2019. We want to increase it by an additional $5 million for those special education teachers. We also want to include all of the support staff that are required to implement a student's IEP. Related service providers, OT, PT, speech, social workers, school psychologists, teaching assistants. They too should be eligible for those increases. Briefly, just want to draw your attention to, oh, not that. This is also in the chat. It is a one-pager. If you are making a phone call, writing an email, or having a meeting with a legislator or a member of a legislator's staff, please refer to this. Go ahead and give this to them. These are the asks and priorities for our OPWDD adult population and care force initiatives for state ed and for clinics in particular. And just to highlight and underscore our ask for clinics, number one, fund the state share of the 30% increase to Article 28 clinics supporting patients with IDD, retro to 1/1/25, just like that EI ask that had been included in the budget and had been passed. This also has not been implemented. We need the state to implement that 30% increase. We're also asking for joint licensure for Article 28 and 16 clinics that serve individuals with IDD. And if there are other questions about any of our clinic asks, please let me know. Please reach out. Happy to go through any one of those with you. There is a really very good explainer for anyone who would like to understand the context for any of these asks. And certainly, we encourage you to send this to and provide this to legislators and their staffs. This explains not just who IAC is. We did this in coordination with our colleagues at CP State and Donnie. This really goes through all of the asks and contextualizes them. It gives you a little bit of the history. It gives you the why for all of the asks. And I encourage everyone to spend some time reading and understanding it, but also if you want to just pass it along to your legislators, that's also more than fine. We just want to ensure that we've done everything we can to ensure that they have the information they need to understand the importance of prioritizing these asks this year. Are there any questions about any of that? Would everyone rather be outside or drinking cocoa? Not outside. No one wants to be
I don't
outside.
see any questions in the chat. I do want to say don't worry about the flyers she's put in the chat. I will also be sending those out, the one pagers and the asks in the email I'll be sending later when I send all the updates from last week. But a lot of great information as always. Now there are a few hands I see for you, Kate.
Okay.
So the first one I saw was Rochelle.
Yeah. Good morning, Kate. Thank you for the report.
Yep.
It's more a question about, is there any organized campaign around the federal problem with releasing the funds that were already appropriated? So, we all focus on the state budget at this time of year for obvious reasons, because they control the funding for most of our programs. But this seems to be, they're creating a very particular barrier. And I don't know, if there's been outreach to Schumer and Gillibrand and, and others.
There absolutely has, but we also, need more. That one of the issues is that in particular, we need to reach out to our Republican delegation. They're in the majority, and there is, we've asked Schumer and Gillibrand, and they have, asked CMS. This is certainly an administrative and bureaucratic delay. It's not unheard of. It's just, it's hard to know. Part of the response for a while had been, attributing it to the government shutdown. Rochelle, very good points. I'll take it back to Winnie also and ask if there's more coordinated advocacy in that area.
Yeah, thanks.
Chris?
Just one thing, Kate, that looking at everything you're seeing there, and I have spoken to a lot of elected officials when I was up there, and they have seen a lot of the budget because the commissioner spoke at the mental health, which I was sitting behind her, and what I'm seeing is documents are going into the official and meeting with their staff. I agree with what you're saying that we have to meet with their staff too, because they need to know the information that represents their districts. And I have met a lot of Republicans and Democrats to make sure and remind them that you have these agencies who are in your district. We do need to make sure that they are aware that maybe they're voters, maybe yes, they go to vote, but they still got to remember that a promise has been made and it must be kept. Because what I'm seeing so far, both sides, There are some are keeping their promises and there are not. And it's not just Republicans, it's also sometimes the Democrats are saying the same thing. So we just have to be very open and more cautious than ever. There's a lot of them are leaving, a lot of them are coming in, and as usual, we have to re-educate the new ones again. But it still have to remind them how can we work together.
Chris, I think that's a really good point that you're
This
making. There will be a lot of legislators retiring in the coming year. I'm sorry if I cut you off. It was a little broken up for me, but you're absolutely correct. Due to a state law that was passed a few years ago that limits the employment, legislators will not be allowed to have outside employment beyond their legislative employment. And so many are retiring in the coming years. We truly need to, and this is a year-round issue, although we've also been advised that sometimes during the summer, right after session ends, legislators need a break, but pick back up immediately in the fall. There's certainly lots to do over the summer, but this is a year-round effort, and the education has to happen before the budget season. Now is a very difficult time. It's still, we encourage everyone to do it. Don't let this stop you. Now is a difficult time to start educating folks on these complicated issues. But start now.
And to say one thing, you didn't interrupt me, so I just wanted to say that
I'm sorry.
even when they're here during the summer, July and okay, let me say this again because I think I'm having Wi-Fi issue. Uh, as I said begin, July and August are the two National Night Out Against Crime. That's how you can get those officials' attention too, as well. So even in the summer, you still have to get them and get their attention.
Thank you, Chris. Debbie?
Hi, Kate. Kate, first of all, anytime you want to come to the Brooklyn's Advisory Council meeting to give a report or send a report to us, you're more than welcome. Because our next meeting is on March 17th, virtually, through Ring Central. And one important thing that I'm going to add, piggyback with Christopher, this year is an election year for the state Senate and the Assembly, as well as our governor, and the statewide offices. I will tell you, everywhere I go, right after they do the primaries, they're all over. Everyone's handing me stuff they want me to vote for them. So I think we need to target them very heavy throughout the whole summer because anytime you see a free concert, they're there. You see National Night Out, all of them are there. Of course, and you ask other members and family members or workers to show up and hand them stuff at the tables because it's their staff. And then you really have to put pressure on them because you say, I don't just lobby when everybody else lobbies. I do it year round. And you see, even though I'm a Democrat, my state assemblyman is Republican, and so is my councilwoman. I will be handing them more stuff. If you want to email us more information, we'll hand it to them. Of course, right? We'll email it to them, but also hand it to them because they need to be educated too because they said they're going to help everybody. Well, I'm going to hold their feet to the fire, like I did to the Democrats too. I don't make things easy for them either. So I'm letting you know that, anytime you have more stuff you want us to advocate, you're more than welcome to show up. I am giving you an open invite because
Thank you,
my
Deborah.
family's, you see, you're welcome. I was sad I couldn't get Christopher into early intervention because at that time it used to be in family court.
That's right.
People don't realize it's much easier now to get it. So we need to make sure that service never goes. Thanks, Kate.
Thank you. Thank you so much, Deborah. All really amazing, excellent points. Brian, if I can, just a couple items of just to wrap up here.
Of course.
I just want to put the information for IAC's conference next week on aging and autism. This is in partnership with Eden 2 and CUSAC. It is at our new offices. You will be the very first, before even IAC staff, to use the office and all of our new furniture. Enjoy. There will be food. Any questions about registration, please reach out to Jenny. Also, there is an opportunity for comment that is rapidly approaching March 1st. This is regarding the upcoming regulations that clarify who is eligible for Article 16 services, services at an Article 16 clinic. In particular, we share a concern about folks who do not have OPWDD eligibility, but do have an intellectual or developmental disability who are currently receiving services at an Article 16 clinic who will no longer be able to receive their services there as it further restricts access to services. There is more information. It's too large. You can comment. I'm just going to do my best to put this in the chat at some point, but the comment period closes March 1st. Just wanted to remind folks of that. And finally, there are a few events coming up. Number one, less than a month until those one house budgets are due. So advocate, 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 advocate. The legislative five-borough breakfast, as Brian has gone through, is on the 6th. There's a rally in the War Room in Albany on March 10th. It's a busy month. March 13th is the rally in the Valley. 3/19, the one house budgets come out, and then our IAC conference will be coming up in June. I'll have lots more information about that in the coming months. That's it.
Thank you so much, Kate.
Thank you.
All right. Rihanna, good morning. Do you have any updates from DOH?
Hi, good morning. No, we don't have any at this time. Hopefully we're working on some things internally. Hopefully at some point in time we'll be able to comment and share with the group.
All right. Well, we appreciate you being here and hearing our concerns and all the topics we're talking about. Thank you.
Definitely.
All right. So next up, we have a presentation from Jordan Fogel from CUNY STEPS 2. I believe they did a presentation and introduced themselves to us last year. I had shared the flyers with you guys in the emails leading up to this meeting. So I will pass it over to Jordan to give you more information on what they're working on for our field.
Hi, good morning, everyone. And thank you to Brian, right, for the opportunity to share again on this snowy day. I do hope everyone's taking care and bearing in mind that spring is, in fact, just around the corner. And a quick shout out to Mr. Greif, Christopher Greif, who sort of been one of the projects I'll be sharing about, sort of champions and consultants for a long time now. So we wouldn't be where we are without Chris's support. Before I jump in, a little bit about me. I've primarily worked on the kind of education and program side of things, you know, from rehabilitation centers to the Autism Society, helping to facilitate neuroaffirming support groups during the pandemic. And now since 2023, with the STEPS 2 study at the CUNY School of Public Health, which is a randomized controlled trial investigating the efficacy of a brand new sex education curriculum for young folks with intellectual and developmental disabilities. The principal investigators are faculty at the CUNY School of Public Health, Suzanne McDermott and Heidi Jones. And I'll go to the next slide. I'll share my screen rather. Let's see. Here we go. All right, I think that worked. I'm gonna go ahead and share.
Yes, we can see.
Just a quick thought. Many years ago, I worked with a legislative advocacy group at the Coalition of Texans with Disabilities. I was there when they passed a cap, prohibition on the 8.5% cap on special education enrollment. So I'm somewhat aware of how hard y'all work, and very much admire the impact that y'all make every day. So here we go. I think I found it. All right, again, steps 2. This is a health education sort of resource for young folks across the state. So some statistics here, that kind of outline the health disparities we see in the community in terms of sexual and reproductive health. Kind of gave onus to this project here. So why are we doing this study? There's a need to improve reproductive and sexual health outcomes in youth with IDD. As many of y'all know, there's an increased risk for intimate partner violence compared to youth without IDD. Young people with or without IDD are at increased risk for sexually transmitted infections. And while many materials exist on sex education for young people, these have not been rigorously evaluated. Our project's funded by the NIH, and the curriculum itself will be available once the study has concluded. All right, so in thinking about how to share about this opportunity with your respective organizations, or perhaps even with folks you know or support, there are 2 groups that people can do. And to be eligible, young folks must be between 16 and 27 and live in New York State and have a diagnosis or identify as having IDD. All right, so one class is the one-on-one intervention arm, and that is highly adaptive, right? We cover healthy relationships, boundaries, and consent, all the way through to safe sex and going to the doctor for sexual health, insofar as it's meaningful and relevant. A plain language booklet comes along with the class, and it's highly tailored to what the young person wants to talk about, previous life experience, communication profile. We work really hard to make it meaningful and relevant. And the other class is actually a group class, so it's a little different. This is the control arm. And here, the focus is physical activity and nutrition. Young folks set goals that we check in about from week to week, okay? Both classes are 6 weeks, okay? And we meet once per week for about 45 minutes to an hour, okay? And then outside of the classes, there are 4 survey interviews. This is just kind of a standardized list of questions. If folks don't know the answer, they can say, I don't know. If they don't want to answer, the question makes them uncomfortable, they can say pass. But every opportunity to do one of these surveys, young person gets a $25 gift card. Those are kind of spread out over the course of a year. So first survey happens before the classes begin, then it's the 6 weeks of classes, right, consecutively. And then when the classes are over, another opportunity to do the survey to get another gift card, then again 6 months after, and again a year after. Okay, and it's just to collect information on how exactly our classes are helping. As I said, it's the first randomized control trial of its kind in a field where there's a lack of research. All right, so again, this kind of highlights what the sexual health curriculum covers. This can be anything from, what are the steps I can take to deal with rejection when that comes up, or introduce myself to somebody, or tell someone I have a crush, right, that I have a crush on them, all the way through to, the prevention of sexually transmitted diseases and protecting against unwanted pregnancy. Like I said, there's a booklet that goes along with the class. And at our final class together, we've developed a form that we fill out together where the young person can put any questions we come up with along the way that they can write down, take with them to their next doctor appointment. Right, and the steps to your health. This is the physical fitness, nutrition class. Again, this is a group class, roughly 3 to 5 young folks. Yeah, the goal that the young person sets can really be anything they want, from drinking more water, eating more fruits and vegetables. And a booklet goes along with this class as well. Now, both of these classes, the curriculums, have actually been studied before. It was developed by one of the principal investigators in South Carolina, where it was eventually made a Medicaid reimbursable service. We've recently updated it, made it kind of comport with current CDC guidelines, and we think it's really special. Over 500 young folks have completed the program so far. I've personally worked with, I think, around 200 or so. And I must say, it's just been a joyous experience, probably one of the most fulfilling of my career. These are the health education coordinators, me, Ariel, and Abigail, that the young person would be working with. A very small but mighty team. And here are some of the testimonials from our lived experience consultants. Educators are friendly, help you feel at ease, can teach you about various foods that can help you increase energy, and it's remote, making it easy to attend or participate. All right, so as soon as I hop off here, happy to answer any questions. I'll be posting the link to sign up for a time to chat with us, to learn more about the classes. That takes about 15 minutes or so. We go over the paperwork to join. We've made the sort of consent and assent process very straightforward, very plain language. The next cycle of classes begins March 9th, I believe. So if you have an interest and just want to learn more, maybe aren't sure, please reach out, chat with us. I'll put a phone number in the chat thread as well, and that's our email there too, I'll be sharing. And if you want to put your email in the chat thread, I could go ahead and send out our flyer for you to share directly if that's easier. But that's all I have for the presentation. Are there any questions?
Thank you so much, Jordan.
Of course.
And again, anytime you guys have information, please send it to me. I try to get it out to the group. We post it on our Facebook, on our website, through the email list.
Y'all have been so incredibly helpful.
And I know you guys have attended our recent event. Well, we only do one major event a year for the Family Support Fair at Brooklyn College, but you guys have tabled there the last 2 years and been able to get a lot of interest and give out a lot of information. So hopefully you'll be back with us again this June when we start planning that.
Absolutely. Thank you so much.
So I do see a couple of hands up. Rochelle, I think yours was first.
Yeah.
Go ahead.
Hi, thank you, Jordan. That it was a good refresher for those of us who saw last year's presentation. I actually have two questions. The first one is, are you able to work with individuals who have more limited communication skills?
Right. So, because you're right, it's virtual, right? There are some limitations that come with that in terms of providing, the curriculum in kind of a meaningful way, right? However, we have a lot of experience working with folks with assistive devices, right? If they use one, and also, we say as long as yes and no answers to questions, sort of some reciprocal communication can happen. We can make steps to kind of a meaningful experience, if that makes sense. But it's kind of on a case-by-case basis. So if someone's not sure, we encourage them to reach out so that we can meet with them and kind of collaborate on how we can make it work.
Thanks. No, that was helpful. My other question is, have you been reaching out to the care coordination organizations, because care managers can make referrals to this program?
We have, we've presented primarily for leadership and at a few sort of care manager sort of like monthly meetings, I think with Life Plan and what's the other one? A few of them across the state. And we've had some success. However, we find that, presenting for care managers and then hoping that they do pass it along doesn't always translate directly into getting sort of more traffic through our door. But we do really want to make the most of that relationship we have with them. So I think we're going to be looking more into connecting directly with care managers and really giving them maybe a better sense of what they can expect of the program and the types of folks who might stand to benefit from it. But that's definitely a well taken suggestion, something we're definitely considering, particularly in this time of uh, uh, kind of a recruitment lull. You know, we're entering kind of the final leg of the study. Like I said, we've served over 500 folks so far. I think our ultimate target is something like 850. So a little ways to go still. So hoping that people reach out to us.
Okay, thank you.
Chris has his hand up for you.
Hey, Jordan.
Hi, what's up?
Yeah. Just to add one thing, you did attend also, just to answer Rochelle's question, you did attend Provider Information Committee 2 years ago. So I just wanted to be aware to everyone that he had not him, but Abigail attended, as well as he has attended not just Family Support Fair, but some of our some of our Development Disability Resource Fair. And he's been very active. So I have been sending them to all three C3 CCOs. But regarding your survey, and I have looked at it, and it is on the advisory's website as well. And I know I forwarded it to Brian. It will be. We do need to remind it's in different languages is also because the survey we've been trying to work on that because I know a lot of people have been asking that question in the past.
Right.
When we do surveys or something, are they going to be in different languages?
Great question. So we have oh, go ahead.
I'm good.
We have, so like I said, we're a small team. However, right now we have Spanish speaking available. And the interview process and support through that, right, for caregivers who speak Spanish. And that's something, right, we have available, but it's always something that we're paying mind to. And specifically applying for funding for supplemental funding. So I appreciate you bringing that up, right? But right now, the classes themselves are primarily available in English. That's correct.
English
All right.
or
I
stuff.
don't. Chris, you're cutting out.
I know I'm saying I had Wi-Fi issue. And sorry, can you hear me now?
Yep.
Okay. No, I was just saying if we ever need it, there'll be more up to date on the newsletter.
Oh, wonderful. I see. I see. I just put a link to the website. We have kind of a little video that summarizes the program, that gives the folks a sense of what to expect. You can find more information there too about how to reach out to us.
All right. Thank you so much again, Jordan. And again, for anyone that came on late or just wants more information, this is recorded. It will be posted on our YouTube, which is linked on our website. So there's plenty of ways to see the information. And you can always reach out to Jordan. His information was there. You can reach out to me and I can connect you guys. But Steps 2 is usually in our monthly meetings or at a lot of our events. So they're easy to find if anyone has information or wants to get more information on what they're doing or how to access their study. All right.
Thank you,
Thanks
everyone.
again. So just really quick, a few updates from the council committees. I know not everyone was able to be here today, but there is no meaningful day committee this month. We postponed it to next month just to provide some more time because the topic is going to be community and facility based rehabilitation services, and we're just trying to secure enough people to come on and be able to share information. So that meeting will be taking place on March 17th at 4:30. And again, you're going to get an update from me with all the upcoming meetings, but the family provider and care management information that's co-chaired by Debbie is March 11th at 10 a.m. The legislative committee is March 12th at 10 a.m. The Family Support Advisory Council is March 17th at 10 a.m. And then our next monthly meeting is March 23rd at 10 a.m. It's on our website, on the calendar. It will also come out in the email after this meeting with all the upcoming meetings. Chris, do you want to do, or Debbie, do you have any report for the advisory council? You can go ahead,
Yes.
and then we'll go to Chris for the
Yes.
MTA.
Okay, just make this quick. We moved our meeting to Monday, February 9th, and we were at the Grand Armory Plaza Library because we had Alberto Pruitt, the Director of Bureau of Assessment and Oversight Coordination, with Kevin Bryant. They explained the difference between the CAS and the CANS. And the CANS is for people under age 17 and under, and CANS for 18 above. And they will come back to do another presentation. And it was a very interesting meeting, but we did get a lot of information. And they met. So if we can have them maybe even present sometime later in the year. All right. But we are doing it on March 17th. So that's it.
Excellent. Thank you.
Welcome.
Oh, I just want to say really quick for our next upcoming meeting, what I said was March 23rd. We do have 2 presentations scheduled for that meeting. So we're going to have a representative from New York Lawyers for Public Interest do a presentation on housing subsidies under OPWDD. And we're also going to have a quick presentation from Uniquely Me Creative Arts founder Dion Jones. All right, Chris, your MTA report?
Yes, as you're aware, today the MPA committee is moved to this coming Wednesday, so it'll be the full board and the committee meeting. Moving on to the other things, as you may saw already on Facebook and everything on the news media, yes, Sheepshead Bay is now open. There is now an accessible station. Also, just be advised, also on the Brighton line at Kings Highway, the Kings Highway elevator is not down, but they are putting the new fare gate at Kings Highway. So the Kings Highway main entrance with the elevator is not available for the next 2 to 3 weeks. So please, if you're traveling to that area, please use the B49 bus or the 68 bus to Avenue H, which is a ramp, or go to Sheepshead Bay to catch the train there. Please allow yourself additional time. Be advised also, please make sure that everyone, if you have not switched over from your reduced fare MetroCard to your Omni, please do so. And this is for everyone. Doesn't have to be a reduced fare, doesn't have to be accessorized, could be any type of Omni card. Please secure your Omni card. Make sure it's registered, so in case you ever lose it, you can get the balance and the money safe and secured. Means you can replace the card faster and you don't have to lose the money. And also, just to be advised, also, as some of you are aware, that we are so far, I just said earlier, I was in Albany. So far, we're the only state has not gotten a cut in the transit division. So that's one good news. We should be having an update in the next month or 2 for the Brooklyn redesign. I will get back to you on that. But at the same time, also be on alert because of the weather. Buses and accessorized will not be running at 100%. So please, do your part. Please allow additional time. All MTA buses will be running best they can. But I am going to remind everyone, if you have not seen a bus stop shovel, please, you have the option to call 311, or if you know your local community board, please let them know, and they will contact sanitation to let them know. Please be advised, it is also courtesy, if you know stone owners at near a bus stop, they should have the courtesy to shovel the bus stop. As to remind you, it is a safety. We are aware of this issue. And today there was supposed to be a hearing about snow not being shoveled properly, but that has been postponed to another day, which I will forward it to Brian when it comes available. But as a reminder, everyone, please be safe out there, and hope everyone be careful. The other thing, just to add in, the active committee, which I'm on, is due for looking for new members. That is what Brian has sent out to him. Please, if you're interested, individual or an agency representing that agency could be on the actor committee. So if you have any questions, please send it to me, the information, on the chat, or email me at chrisbrian@yahoo.com. Brian, all that information I just said to you is that. I'm sorry, it's in the email. So if you have any questions,
Perfect.
I'm here. Yeah, if anyone has any questions, I'm here. And just everyone know, please be safe out there.
All right. I don't see any questions for you, Chris.
God bless you.
I know a lot of people have been putting updates and announcements in the chat, but now we will open it up. And Carrie, you were quick. Carrie Banks from the library. I couldn't even finish the sentence and she had her hand up. Carrie, you're not able to unmute?
No, I think I got it now.
Okay.
Sorry about this. I'm working off of 2 phones, so I can see and monitor chat. I don't have access to, because I'm working from home, I don't have access to all the usual stuff that I put in flyers, but I wanted to let people know about the March 13th Developmental Disability Fair that we have coming up. And also our regular one-to-one program where we connect parents and individuals with disability system advocate, parent educators who can help them navigate disability systems. Finally, on February 28th, we have, wait for it, an accordionist at our next Music for Autism concert. We are all looking forward to it. I put the email, no, I'm sorry, I put our website in chat where you can get details on all of this. Thank you very much. And hopefully I'll actually be able to see you next month and vice versa. But in the meantime, come to the fair on March 13th at the Fort Hamilton Library. Is that right, Chris? And
that is correct.
Thanks. We had a wonderful fair last month at the Kensington Library. We had close to around 100 people attended. And it was the elevator was broken, but we managed anyway, having it on the open floor, and it was a really exciting event. If you have not attended these or not brought your clients to these, please do. I think you'll find them really helpful and also fun. Thank you very much.
We're not hearing anything.
I'm the one on mute. Sorry about that. Next up is Doris. Doris, you're on mute too.
Okay. Hi, everyone. My name is Doris Khan, and I hope everybody is staying warm and safe today. And I just wanted to let everyone know that the New York State Institute on Disability has openings for evaluations that are done in-home, and they're for individuals who do not have Medicaid, who are seeking OPWDD eligibility and reside in Brooklyn, Bronx, Queens, and Staten Island. For information, you can contact Elizabeth Sunshine at 917-699-0578 or email her at esunshine@niceinc.org. We also have openings for crisis management services for families that live in the Bronx, Brooklyn, and Queens. And these services are not eligible for individuals that have self-direction services. For more information, you can contact Juliet Hawkins at 917-524-4856, or you can email Juliet at jhawkins@nicetinc.org. NICET also provides reimbursements for goods, services, and camp to individuals that reside in the 5 boroughs. You can contact Jackie Tribodi at 929-202-1115 or email Jackie at jtribodi@nicetinc.org. I want to say everybody sees the snow, but if you're thinking about sending your child or individual to camp, you have to do it now, because if you start in May, you might not get a seat, and if you want, and reimbursement funds could run out, you really should start the process now. NICET also provides tickets to recreation outings for individuals that reside in Bronx, Brooklyn, Queens, and Staten Island. And we do not provide recreation outing tickets to individuals with self-direction services or reside in Manhattan. You can contact Sarah Alton at 718-494-6457 or email salton@nicetinc.org. NICET also provides free transportation services for individuals that reside in Brooklyn, Bronx, and Staten Island for medical appointments and recreational activities. And you can call John O'Grady at 917-747-9424 or email jogrady@nicetinc.org. Thank you, everyone. And I put our flyer in the chat with all these numbers and email contacts. Thank you.
Thank you, Doris. Next up is Ellie.
Hi, I'm Ellie Rufer, co-founder of New York City Fair. But first, I just want to say that you just gave me a flashback. I met Liz Sunshine maybe 30 years ago. I don't know, when my daughter was in an 853 school. She turns 44 today. It's her birthday. So you just took me back in time, and so now I have to regroup my head. Anyway, some stuff never changes, right? New York City Fair is holding a not town hall, more like a round table or a chat or something. I don't know. On March 11th, save the date. It's 7 to 8:30 p.m. It's about the budget, but spoken in English, not in OPWEs. So Winnie Schiff and Chris Marchioni and Kate Hoy and Kathy Verano will give us an idea of what it means to us, what it means to our kids, what it means, period, and what we have to do about it. Because what's in the budget is not enough, and that's for sure. So join us. Registration should come out this week, and please save the date. Thank you. And I'll sit with my flashback later.
Thank you.
Yeah.
Thanks, Ellie. Sandy?
It's me. Morning, everybody. I hope everybody's enjoying this lovely winter wonderland. I know I am. Anyway, I want to let you know about 3 exciting webinars that Adapt Community Network is having. As you already know, probably know, that we always have Spanish and Mandarin interpretation, and they're always free. So the first one we're doing is this coming Thursday, February 26th. It's Guardianship and Future Planning. You will learn about 17A guardianship. We'll discuss supplemental needs, trust, and ABLE accounts. And Stephanie Barron, an attorney from AHRC, will be presenting, and she has lots of experience with this. And the next one following that is Guardianship 17A, filling out the forms. So you'll have the opportunity, if you're interested in 17A guardianship, to learn how to fill out the forms line by line. And Stephanie Barron will be doing that one too. Next up is the evaluation process in children with ASD. That's Thursday, March 12th, 10 a.m. to 11:30 a.m. And Dr. Michelle Gorenstein will be talking about the evaluation process. She'll focus on the different diagnostic evaluations available to diagnose ASD, what types of evaluations are needed to access services, and more. So I've got all the links to register for these 3 webinars in the chat, and I also dropped the flyers as well. So I hope you'll attend. Have a great day, everyone.
Thank you, Sandy. And those will be sent out in my email later as well, because I saw when I was away last week, you had forwarded them over.
Thanks, Brian.
You're welcome. Maria.
Good morning, all. My name is Maria Willis from CP Unlimited, and I have 2 announcements. Both flyers are in the chat. CP Unlimited is having they have an Article 16 open house on March 4th in Brooklyn. That's from 10:30 a.m. to 1 p.m. The address is 921 East New York Avenue. And also for other boroughs, CP Unlimited is having, in addition, they have opening an Article 16 open house on March 5th in the Bronx, 11:30 to 12:30, March 11th in Queens from 11:30 to 12:30, and March 18 in Staten Island from 10 to 12. I put the flyer in the chat with any additional information that is required. RSVP is needed. Thank you.
Thank you, Maria.
Thanks, Brian.
So I don't see any other hands. So I don't know if it's a good thing or a bad thing that we're getting extra time back, because it probably means you have to get out there with the shovel even quicker. But I assume we can end the meeting a little bit early. Appreciate everyone that was able to log on and delay the inevitable. Thank you to Jordan for the presentation from CUNY and for everyone else that presented and gave updates from OPW and IAC and everywhere else. Appreciate
Bye,
you guys.
Brian.
Please be safe and careful. Take your
Same
time.
to you.
Take breaks. And this has to end sometime, right?
Spring is
True.
almost sprung. Couple of more weeks.
Yes,
Yeah.
and
Eyes on the
Brian,
prize.
and Brian, my dear, you need to be careful too. Follow your own advice.
Just say
Yeah,
rain.
I will.
Be safe,
Okay.
everyone.
Yeah.
Second that.
Thank you, everyone.
All
Have a
right.
great week.
Take
Have a great
care.
week.
You
Bye-bye.
too.
Be
Bye.
safe.